So again, Eric Preuss with the Iowa Gambling Treatment Program, and want to welcome you to the IPN iSmart Problem Gambling Domain Training. Thinking we'll probably go about an hour and a half or so. Hopefully we'll be done sooner than that, but want to make sure that we give ample time for questions at the end. Have put together an agenda, and we'll have that agenda available along with the recording information here as we get going. I'm just making sure I've got all the chat stuff open. I'll try and monitor chat too, so if there is a question or two that comes through, feel free to be able to put your questions through on chat. And again, just as courtesy, always good for everyone else to be muted on their end, and remember to unmute yourself. And hopefully we won't have too much competing background noise here, but we do have a couple of other meetings and things going around my cube here. So as I mentioned, as far as welcome and introductions, please put your name and agency via chat, and that will be helpful for me. And then we will have the link made available on the IGTP website. I gave the link right there that you can do, and actually we'll show you that here in a little bit. So, and actually we'll just go ahead and go there first. So one of the things here is that for some of you, this is going to be a refresh, and for some of you, this is going to be your first foray into reporting problem gambling treatment data. And so I will do my best to be respectful of both sides of the equation there for folks that have been around and have been doing this for a while. And welcome to the new providers as of January 1 that'll be coming on board. I'm sure you'll have lots of questions. I'll do my best to answer them as we go through today. And again, so as far as just some cursory background, some of you have found this information, but just to let you know where you can find information about the Iowa Gambling Treatment Program and gambling treatment information in general, and that's at the IDPH website, idph.iowa.gov/or / however you see that, IGTP for the Iowa Gambling Treatment Program. If you've not had an opportunity to, I'm just going to log out here for a second. Hold on a second. I really don't want it. There. Oh, come on. There we go. I was in editing pages earlier. So in here at the Iowa Gambling Treatment Program homepage as part of the IDPH website, you can certainly peruse and take a look at many other tabs. I am not going to show those off to you, but know that they exist and they're there. The one that I'm going to take you to specifically is the treatment page, as it has the information for the treatment. And you will see that there are many resources that are available here as far as clinician resources. These have been developed over the years and have been put here as approved materials that can be used and links that would be appropriate to be used. Many of you have asked about choices already, and it is under an update, and so we actually don't have the booklets in print anymore. They will be in print again in the near distant future. We are in the process of doing an update on that, and as you look through here, you will actually see, where is choices listed here? It's because it's under workbooks and activities. So choices, a guide to understanding and changing problem gambling behavior, is under workbooks and activities. So may need to update this page a little. So anyway, resources at the top, financial tools are in here. One of the requirements that's in the RFP is that for individuals to also receive financial counseling as part of the treatment that they're provided, there are a couple of resources that are here and that are available. Just remember to mute yourselves locally. That will assist in minimizing the background noise. The section we'll be looking at a lot today is the IGTP data entry section. There is a data integrity reports manual that in the process of updating for you. I haven't got the updated one here. And there's some information here that we'll be taking down, but the ones that we'll be looking at specifically today are this iSmart data entry matrix. And that was just updated. I just uploaded these today in the iSmart Problem Gambling Data Entry User Guide and Manual, and we'll be referencing those today as we go through. In fact, let me just go ahead and open each one of those up so that I've got them open, because we will be looking at those later. There's also a section here on screening tools. The DGSPS is the Disordered Gambling Expert Pre-Screen and Screen. We'll see that when we are actually walking through iSmart here in a little bit. And some of you are familiar with the brief biosocial gambling screen. There's actually a link here where they've got it available in 22 different languages if that's something that you're interested in taking a look at. So I think as far as the treatment pieces, you'll also see there's information here on helpline data, reports and studies, stakeholders information, and again, more information will be coming on January 10th as far as trainings and stakeholder meetings and that type of thing, as we have that meeting scheduled on January 10th. And then there's a tab in here as training opportunities that are also available, and that also includes webinars that we've had recorded. I know some of you have been asking, well, what are some things that we can be doing in the interim? Well, we've got a series of 7 or 8 different webinars here that would be beneficial in getting people some of those gambling education hours to assist. So I'm going to go back to here. Let's see what I miss. Anything? Everything. Oh, I did not show you. Let me go back to here. So you'd probably notice on the treatment, there is a treatment tool Spanish, and a shout out to Nick Foss and his people over at ADS in Southeast Iowa. They actually provided these details from the work that he's done. I think most of you know Nick is bilingual, has had some other staff there that have been bilingual. And so they've provided these Spanish-based tools for the treatment side that are available as well. So just moving on to overview on what has changed under the new IPN contracts that will start on January 1. Probably the biggest thing that'll happen for those of you who have been part of the Iowa Gambling Treatment Program under the previous RFP that ends on Monday is the discontinue of the use of the adjudication module in iSmart. And so there'll be no contracts, no vouchers, that type of thing. So some of you will go, that's a huge sigh of relief, and others you go, what the heck is he talking about? For those of you who don't know what I'm talking about, don't worry about it. But for those of you who have been using iSmart over the last 2.5 years for problem gambling, as a funded provider, know that that will be discontinued as of January 1. There are new service descriptions, and I am going to actually show you in the data entry matrix that we've just uploaded. We had developed this tool 3 or 4, actually 5 years ago, or for fiscal year 15 was the first year that we had this. And it is, we created it just as being an assist for you in how to enter encounters into iSmart. You'll see this when we actually get into iSmart. So it actually lists the outpatient covered service license program services for patients for problem gambling, the actual specific services as they will exist in iSmart. And I'm not necessarily going to just know this is out there for a resource, but it's going to tell you what the unit is that is based on how is this going to be paid, the encounter type that you'll actually use, and the encounter in iSmart as you're entering, what you do with the start and the end date, whether start and end time is needed, and in case all of these, it's not required for anything. It's only if you want to enter in there. And then some direction about, well, what do you do with the duration field, and what do you enter into that as far as what you enter in the number of sessions or the units field on the encounter. And then how is billing going to be determined when you're submitting at a provider level for your monthly claim. So I wasn't going to spend a whole lot of time going through this other than to let you know that it is developed or is created much the same way as the unit rate sheet is within the IPN manual, draft manual that has been provided to you, as well as what was in the RFP. And I think some of the rates have been updated in your contracts from basis what was in the actual RFP. But I think those have been updated in the IPN manual as well. And I know that they're looking to get the final of that out as well. So the outpatient covered, other covered services for patients for problem gambling, those are listed. Probably the biggest change again for previously funded IGTP providers for problem gambling is recovery support services have changed drastically. So you've got now care coordination, which is figured completely different than how we used to do it under problem gambling. in this project period. So now it's a per month per patient, and it's not anything that gets entered into iSmart. I was even tempted not to put it on here, but figured this is a good place just to put that it's not entered into iSmart, that care coordination as a service will not exist as an option after January 1. And then we have medical evaluation, which is new, and medical evaluation telehealth, medical care telehealth, medication, and then probably what would be the two holdovers from the old recovery support services would be recovery peer coaching and transportation. And then again, the information that's available here on this chart, as well as what's in the provider manual and the RFP. The other probably big change is the addition of early intervention. This is in essence replacing, for those again previously funded providers, what was called crisis. And certainly crisis can be provided either in a group or individual setting. As far as early intervention services, some of you may ask what is going to happen regarding warm handoffs and that type of thing. And for the previously funded providers, since they're used to that, we are going to continue with them covering the state until more discussion happens at the meeting on January 10th, and get a sense of what we might be doing with the warm handoff process. So for the currently funded programs, as you've got questions of what that's going to look like on January 1st, please feel free to reach out to me and be happy to talk and discuss with you. For programs who haven't done the warm handoff, you'll hear more about that as we get to the meeting on January 10th. There's also some notes in here that I put in here that reference this as we go actually into iSmart. The other big new thing for problem gambling is the use of intensive outpatient and partial hospitalization. That was a service that was not previously billed under the Iowa Gambling Treatment Program. So this is a new service as of January 1, and much as per the RFP, it says it's going to be entered within a counter type of 24-hour service for each day that a IOP service is provided, and that a date range may not be used with that. Early intervention, I talked a little bit about that. I think the other big thing on this is the duration. Just to note that everything is to be rounded to the nearest 30 minutes when reporting an encounter in iSmart. You'll see that when we actually do a little bit of a walkthrough. And the other piece, I just put the note in here about treatment episode. A treatment episode is defined as a period of service between the beginning of treatment service or drug alcohol, which we're talking about here for gambling, and the termination of services for the prescribed treatment plan or discharge. And so just know as we're talking about some of the limits that are on some of these services, which are better shown here, because I just put the actual chart from the IPN manual is listed in here. So you can see for some of these services, there's a limit like per month, per treatment episode. And so just be aware of those limits on there, because that is going to be up to you to monitor and track. We will be developing some reports for you that you'll be able to pull that information and help you track that. We don't quite have all those reports developed, but hopefully we'll get those developed for you within the first couple of weeks of January. So any questions on that information so far? So Beth from Jackson was asking a question about, so crisis calls are going away as well. Not really. And you'll still be able to enter crisis calls when they are, you have client identifying or patient identifying information that you can enter into iSmart, and they can be entered that way. Again, for the previously funded providers, we used to have a crisis call log. That crisis call log is going away. It will not be accessed. It'll be available out there and you'll see it, but it is not to be used after January 1st. So as programs have been reporting and tracking early intervention services, those crisis calls will now fall under that early intervention, and each program will need to, for those non-patient related services, that is, you don't have patient identifying information that you can enter into the data system, whether it's a central data repository or in this case iSmart for the problem gambling domain, then you'll need to do some internal tracking, and you'll need to be able to provide that documentation to us at the point of a retro review that's being done. So hopefully that answers your question. That was a good one to ask. Thank you, Beth. So any other questions specific to the matrix? As I said, this is posted. You can take a look at it. You can download it. Just notice that I've got a font issue that I got to fix on this, but doing my best to have that available for you. Any other questions on this specific form? All right. So I think, let's see, I was saying CETA, so we talked about IOP or outpatient, and that IOP, partial hospitalization, is new. Kind of walk through the outpatient covered services there for problem gambling. You saw those on the matrix. So I don't think there's really anything else to cover there unless there's specific questions that you have regarding what we've covered so far. Okay, so one of the things that I do want to show you is moving on to staff member account setup for iSmart Train and production and SSRS access. And let me go ahead, and I'm just going to get into the production site here for a second. I have gone in for all programs, and you've been set up in both train and production. So for new programs that have not used the problem gambling domain, you have the ability to access that in the training site and the production site. And both have been set up identically as far as the new services. And oh, I gotta remember my password. No pressure. So the one thing when you're logging into the production or the training site is one of the things that you want to make sure that you've got access to is this SSRS reports option up here at the top. And for agency administrators that might be on here that use that agency administrator configuration, I will show you here, except there we go, staff members. I think I've got this one that I can show you, which keeps it pretty simple. So when you are looking at your user account, and this is, I'm set up at the WITS level, but there is this SSRS agency reader that is actually available here at, if I edit this, let me come down here and manage roles. So if you do a search over here, oops, SSRS, you will see this agency reader role, and that is the role that you want to be assigned to anyone at your agencies that is going to need access to SSRS. And I'll show you what that looks like here in a second and why potentially someone would want to have access to SSRS. So that is one thing that you would need to give yourself. The other, as you scroll down, is the only other thing that you need to give yourself is making sure that you have clinical full access granted to yourself. You'll see there's this gambling education full access, gambling crisis full access. So for programs that are currently funded as of the end of the year, you'll continue to have access to that probably through the end of January, middle of February, and then we will be turning all full access off to both the gambling education and the gambling crisis modules within the problem gambling domain. So just be aware of that. So the other thing that you will then need to make sure is that under domains that you have gambling listed. So really the trick to have access to the gambling domain is, number one, make sure that you've got gambling domain selected as added as a domain, and that you have clinical full access listed. The other thing that you can do, well, before I move on, let me just hit done editing here. I'm gonna move this out of the way. And I wanna get my other information up here for a second on the agenda. So the other thing that you can use is also of assistance, and I gave you the link here when I send this out, and it's actually on the iSmart homepage, but there is a guide here for iSmart agency and system roles, and then if you see problem gambling here for agency account roles, it tells you what it is that you can have, and again, as I mentioned, we'll update this to remove those two. And then the other one that you want to add is that SSR agency. And again, it's showing it as a system role here, but that can now be added as an agency role. We need to update this, but at least to let you know that that is out there as a cheat sheet for you to help as to what roles should be assigned at the problem gambling domain. So I'm going to come back into, oops, I'm going to come back into iSmart, except it's not letting me pull it back across. I should just do it this way, so it's up at the top. So the one thing, we'll go back to my home page, and just want to click on the SSRS icon link and show you what it is that you'll be wanting to access in SSRS that will be of assistance to you. Now you're seeing much more here because I get to see everything that's in here, but there's a provider reports folder that will show up, and this is actually the view that you all have. You will see that each of you are going to have your own folder, and you'll only see your folder. You won't see all these other folders. So if ads logs in, all they'll see is ads folder plus this IGTP reports folder. There are some paginated reports that are down here. Most of those are related specifically to the VMS and will not come into play for most of what you'll be doing January 1 and after. Most of what you will find will be in these IGTP reports, and most of these are your data integrity reports, but as I mentioned, we have some programs. There are some reports that we've developed in here. There's one for the 30-day follow-up, which we'll talk about here in a little bit. There's also one, this RSS project period totals. These are the reports that we will update specifically to those cap limited services that are in the new RFP, and we'll update those. So these are the reports that you can access to give you some assistance with monitoring the performance indicators and or the services that might be going on with your patients. There is this problem gambling treatment plan and 30-day follow-up status report that we developed for ads and has been made available to everyone, that if you're using the treatment plan module and you want to be able to monitor the 30-day when the 30-day is due, this is a report that you can use that shows all your active patients and their treatment plan status if you are using the treatment plan within the problem gambling domain. It is not required that you use it. It's that some programs choose to use it because they find that very helpful. Okay, any questions on roles or anything that I've shown you so far as setup and accessing SSRS? Okay, well, I am going to go ahead and close out that. I am going to close out of iSmart here. And I'm actually going to get into the training environment because I think, oh, the one other thing, and I can show you this in Train, is since we've never offered another level of care other than outpatient, that one of the things that I would encourage each program to do, and I'll show you this when I go into Train, is that as you look at your facility and program setup for those problem gambling facilities or programs that you have set up in iSmart, is that you can now tag those to a level of care. The one thing we did discover in some testing is that for whatever reason, when we assign a 2.1 level of care, we're still having some issues with the encounter actually allowing days to be chosen during the duration type, and you'll see that when we do some of the testing here, but I just wanted to point that out to you. So with that, what I'm going to try and do is just walk through for you. First, I'll show you that agency facility program setup when I log into iSmart, and then walk you through putting in a crisis, a placement screening, an admission, and a discharge. And again, feel free to answer questions as we go through this, and we'll have a time for Q&A at the end as well. So let me minimize this for a second, and let me get into the training environment here. I'll bring this back up. Move this over here. I'm going to first sign in as my WITS administrator role here, and then I am going to do a gambling agency, but I wanted to show you the agency piece. My caps lock is not on, so what am I doing? I am in iSmart Train. There we go. Must have been fat fingering something. So anyway, going back to what I wanted to show you under agency and under your facility list, and then programs. And so I'm just looking at facility list, IDPH gambling here, or actually I think I was doing it on gambling only. See what programs that we've got established. So in here I did set up a program name called Early Intervention. Some programs may have something called pre-admission, but what I wanted to show you, and as you set up these programs, you now have the ability to put early intervention as a 0.5 level of care. In the past, we've considered crisis services a level 1, 1.0 level of care as far as ASAM. So you have the ability now to go in and actually choose that 0.5 level of care for however you're going to track those early intervention services that you're going to be, that you would have patient identifying information that, and you could actually enter that patient into iSmart prior to admission. Some of you have sort of a pre-admission if you want to continue to use that. There is no design on my end of what you need to call your programs. In this case, if we wanted to add, because we don't have a outpatient. Oh, all right. I'm just going to put EOP for simplicity's sake here. Domain would be gambling. The modality is going to be gambling. And the specifier, again, would be adult and adolescent outpatient. And the level of care, you'll see, because it chose gambling, it's NA, but you do have the ability to come in and choose the level of care and put that in there, and then put a program start date. One thing, if you've not done this for a while, you also have to go in and add capacity. And again, this is whatever number you would want to put in there. That is not any data that gets reported to the state. We don't use that in any shape or way. It's just a requirement in iSmart to finish up a program setup. And then for intensive outpatient, for just simplicity, we'll just call it IOP. Again, domain will be gambling. Modality will be gambling. And we'll say it's adolescent adult outpatient. And again, here's where you could, again, put 2.1. And then if you were offering partial hospitalization, you would create a separate program for partial hospitalization as well. Save, add a capacity. In this case, it'll be slots. Put a start date. Again, for many of you, that'll be a start date of 1/1, most likely. And so then you will have developed and put in the programs that you potentially could be using to enter services. I'm going to go ahead. So any questions on that? I know I went through that really quick, but that was just to show you that you've got the ability to tag a program to a level of care. See and checking to see if there's any questions. Okay, well, we will move on. I'm going to log out of Train here and then come back in under my actual gambling agency login here. So you're going to see exactly, you should see exactly what you will see when you log in with just access to the gambling agency. I need to go find my password here real quick. Which one am I using? Okay, so when you log in, and you'll see as I've been logged in, I've got access to SSRS up here, and I have a very limited menu now on the left-hand side based on how it is that I have been, because of the roles that have been set up at my staff account. You can click on agency, then see what you have access to, and can see that it's pretty limited. I still have billing enabled here, and that is, again, something that going forward we won't be using, as well as the prevention. So let's go ahead and we'll just start at the client list here. I know many of you are familiar with how to use iSmart and how it happens. So I'm just going to go straight to the client list here. And I am just going to create a new client. And again, we'll just say test IPN. I don't think I've got anyone in here by that name, so that we'll go ahead and we'll add that client. And we'll put a birth date in here. And again, last four is social. I haven't shown you, but and I'll just use this as a time. I think I have it. I brought it, opened it up. So there is this iSmart Problem Gambling Domain Data Entry User Guide and Manual that I've updated and I've put up on the website, so you can download this now and have access to it. And it provides an overview of just about everything I'm going to go through today, explaining each of this. It's been updated to the IPN language as best as that I could catch everything in here. I think the other big change for many of you is going to be the due date of when data is due for a month, and it's due by 11:59 on the 15th of every month. That's a change for how we've been reporting data in the past. And it talks a little bit about the table of contents and how to navigate. But in this document, it will go through and give you the required definitions for every single field that we'll be walking through today, as well as walking you through is what we're going to start with the crisis module. There's a section here at the end that talks specifically about the crisis module. And then there's a section here that talks about the 30-day follow-up, which you'll also see. So just to highlight that what we're going to be going over is covered in that manual. So I'm just going to go ahead. And again, you know, most of you have been in iSmart and have filled out things. So if I go through something too fast, please feel free to stop me and I will add that information to you. This is a new update that we've had in the system, that saving a profile without an address is that it will now require that you go in and put an address before you can actually save the profile. And again, the default zeros if you don't have a phone number, and then adding an address. And as most of you are aware, iSmart will prompt to say, is that really an address? Oops, I forgot a digit. So it does connect with USPS to say, hey, this is the correct address, and in this case, it's a fake address, so it doesn't is not giving me an option. At this point, click finish. So at this point, we've now created our test case for today that we'll be using. And in order to start a gambling episode, and we'll just say we're going to do an early intervention service, we got a phone call from Your Life Iowa regarding 1-800-BETS-OFF call that came in from my county. And I talked to him last night, or I'm talking to him right now, and I want to put the information in the system. So the first thing you have to do is start a new episode, and probably the key point here is that when you're creating this new episode is that you have to make sure that you're creating it within the gambling domain. And if you get to this point and you don't see gambling domain, that would indicate that you do not have access to the gambling domain, and that would mean your staff member account roles need to be updated to include the gambling domain. So I'm just going to go ahead and continue filling this out. Source of referral, very important if they are calling from the helpline, that you ask, as you're talking with them, obviously if you're getting a referral from the helpline and that's why you're in contact with them. But even when they're coming in, we keep close eyes on seeing the relationship between the number of calls that we get in to 1-800-BETS-OFF in Your Life, Iowa, and those people that actually come in for services. Data first contact, I'm just going to backdate this to the 1st of December to give me a little room to work. You'll put a reason. This is why they called. And again here, and again this will be a little bit different than for the new providers, is that you have the ability to either designate this person as a gambler or as a concerned person. And in the case you can admit both a gambler and a concerned person for services, there is not a differentiation on the gambling side like there is on the substance use disorder side. So you can actually work with both a spouse and a problem gambler at the same time and bill for both of them. If you see them both in the same session, you're only billing for one of them. But in this case, we're just going to go ahead and say this is a gambler that I'm working with. And so once I click finish, then it creates the activity list for me that shows that the profile has been completed and the intake transaction has been completed. And at this point, we were talking about we wanted to go ahead and enter a crisis because we're doing that early intervention conversation with them. So in this case, we're going to be able to enter the information for that early intervention service. We're going to add a new crisis record. And it's very minimal data entry point. We're going to say we talked to this person on 12/1. It'll automatically do a wait time automatically for you. And again, for programs that have not used this before, that's a little different than how it works on the substance use domain within iSmart. Here on the gambling side, it is automatically figured for you. The other difference too is that wait time is figured from first contact to crisis, first contact to placement screening, first contact to admission, which is a little bit different than how we do it on the substance use disorder side. This is, although you can go through and see on the left-hand side menu here, you have all of these other data points that could be collected. The only required data points are only on this sheet. You can then click finish. And you will see now that it is, it's a crisis, it's been entered, and it is not in process. So let's see, look at some questions. So there's a question that came in. I may be jumping the gun, but if we no longer use iSmart. So if you've no longer used iSmart, your agency still has iSmart available to you. So I would send the iSmart, the help desk, a inquiry to helping get users set up within those environments, both if you need in the training site and also on the production side, so that you can become familiar with how to use the problem gambling domain and get the right staff account set up for everyone. So do we need to, Marcia's asking, do we need to switch back to iSmart, or will you cover the CDR too? So this, again, it's a great question, Marcia. Problem gambling domain data only exists within iSmart. It does not currently exist in the central data repository. So per the RFP and per the IPN manual, problem gambling services will be entered in iSmart only. There are, so again, some programs have chosen to, we've got several on the call that whether they were using IOWITS or their own EHR, they were still putting all of their problem gambling data in their electronic health record, and then they were putting the data in iSmart for the data reporting purposes. One thing that I would tell you, we are looking hopefully to get to an integrated spot. I mean, we're working on that right now. So hopefully in the not too distant future, you will be able to report your gambling data directly from your electronic health record. So that was sort of a long answer to you, Marcia, but for the interim, yes, if you're putting it in in your EHR, you'll also have to put it into iSmart in the interim. So with the crisis now being entered here, the next step would be that I need to be able to enter the encounter for that early intervention contact or crisis contact, however you would like to define it. And in order to do that, I need to first enroll the individual in a program. So in this case, I'm going to go in and have a pre-admission that I can use here, and need to make sure that the date matches with the date of service that I'm going to put in. Now that the program enrollment is available, I can then enter the encounter for that service. And so I'm going to add a new encounter note. And so in this case, it'll be an individual note. The event type, I've only completed the crisis, so that's all that's available. And then here you'll see only IPN early intervention shows up. And that's in the training site. We've already discontinued all the previous service descriptions that have been tagged, that have been part of the Iowa Gambling Treatment Program. So when you, so programs who are putting in their data in for December and they start putting services in for January, under IPN, you'll want to search for those service descriptions that begin with IPN and make sure that you're choosing a service for services that happen January 1 or after that have that IPN designation before the service. And again, you can refer back to the data entry service matrix that I provided. So New Opportunities was asking about, we'll be able to do electronic consents in iSmart like we do in WITS. You know, that's a good question. I don't know that that is actually turned on in the problem gambling domain, but I do see that I do have access to consent over here. I've not ever tested it. I would say if it's there, you can use it, and potentially can be used to consent between agencies. So that's available. So it's a good question. So I would say, yes, you should be able to use it. If we have an opportunity, we'll come back and take a look at that a little bit later if time allows. So I'm going to go ahead and put a start date in here, 12/1 for 12/1. And you'll see here, it's just saying, need to ask the duration, and I'm going to put it that it happened for 30 minutes. You will always enter for, when you're using duration, units will always be 1. And primary payment source in this case, and this is a little bit different, it's state unit reimbursement. We don't have IDPH funded. Don't ask me why we don't. I didn't create this on the gambling side. That was created before my time. So unlike on the substance use disorder side, you'll see IDPH funded. On the gambling side, you'll be using state unit reimbursement. And then for an early intervention service, there is no additional charge for that. It's 100% paid by the state. So at that point, you're basically done. However, for those programs that are wishing to use the problem gambling domain as the place they're putting everything in for the clinical perspective, of which, you know, they don't want to put it in their EHR, they want to just put it here. Certainly that is an option. There is page 2 where you can actually put the note in, and if you're using the treatment plan, you would then modify and put the goals here. So at this case, we don't need to worry about signing a note. We'll just click finish and we'll click go, and we'll see that the note is now there. So any questions about what I've covered so far? See, Deb's offered a new question. With clients who are already entered in iSmart, do we need to do anything different with them starting January 1st, or are they good to go? Good question, Deb. I don't believe you will need to do anything different. Because the programs that you have set up, I think the only thing that you'll need to look at is, do you need to set up an intensive outpatient program that you probably don't already have set up, so that you can track that if that's important for you to track internally. You should just be able to see, you'll see the current services that are available, as well as the new IPN services that go into effect on January 1. And you'll just need for those services on or after January 1 to make sure that you're selecting the IPN labeled services. Now you could go in and have multiple early intervention crisis sessions with this person. You could do face-to-face with them. You could do group with them. If you've got a pre-contemplative group that you have with folks that you're doing that fall within that early intervention framework as a pre-admitted service. You can certainly build that and have them participate in those things. And the one thing that we've asked is that if at this early intervention level is that if they've not been involved in services for 30 or more days, then just to close out that episode, and then if they return, to start a new episode. That just helps us with that wait time tracking, because remember, we're tracking wait time from data first contact to crisis, data first contact to placement screening, and then data first contact to admission. So we had one instance here that came up, that we had one that had a wait time of 592 days because the crisis episode had been open for a very long period of time. And so anyway, so next place is we're going to say, hey, we've worked with this person maybe several times. I'm not going to put all the encounters, and they've decided, yes, now I'm ready to be assessed. I'm seeing that I might have a problem. So we're going to go ahead and put that placement screening in. And much like on the substance use disorder side, you have the ability to put both of those in at the same time. So in this case, we're just going to fill out the information. Again, I'm going to run through the entering the fields. I'll try and draw attention to ones that can be somewhat troublesome, or I shouldn't say troublesome, but where questions often come up. So I'm going to go say I decided to come in on that Friday, and we're just going to navigate through here, and we're just going to answer the questions that they come in. And again, for those of you, and I guess one thing that I should note is, let me go back to, see, I've got these, let me go back to, oh, I must have closed it. Hold on a second. Let me, I forgot what it was that I was going to show you. Right, never mind, absent-minded. Yeah, was a reason to show, maybe I'll think of it here. Anyway, we'll move on. So was gambling a accepted activity when growing up? So you'll just answer the question, how old were they when they first gambled? When did it first become a problem for them? And again, this is just their self-report. Who did they first gamble with? And you'll select that. Then there are, when you gamble, what is the preferred method of gambling? And you will notice that we have a primary, secondary, and tertiary are not applicable. So you will just ask them about each one of these and whether or not it was primary, secondary, or tertiary. And in this case, I'm going to say that this person really liked to do casino and fantasy sports, and they like being on the internet. And so the rest of these, and again, they all are required. And so they all have to be selected. The other thing you can do also is that it's case sensitive. And so you can just tab through. I'm just hitting N and then hitting tab, and that gets done. So at any point in time, you can save or finish. You can come back and complete it. In this case, I'm just going to keep pushing forward. In this case, it's going to ask the date that they first gambled or they last gambled. And I say it's going to be the date before I came in and I made my call. How many days did I gamble in the last 30 days? And when you gamble the last 30 days, we're usually alone. And then the last 30 days, did you gamble at any of these places even once? And there's a whole list here. And so you have to do a bit of scrolling. And again, you can use your shift and your down arrow to select all these. And I'm just going to say we did all of those. And we can move them across. Oh, he really didn't do it on the internet, or he didn't do it at a sporting event. You can move that back across. Then it's going to ask kinds of wagering the last 30 days. And again, you're just going to report the days. And I'm just going to put one for each. The response is required for each of them. And again, definitions for each one of these are also in the data entry user guide. Then there's the behavioral questions. Have you ever been treated for a mental health problem? If you enter yes, then it's going to ask you how many times that's happened. Have you ever been treated for a drinking or a drug problem? Again, you'll respond yes or no. Not including this times, how many of you been in a gambling treatment program? And then it's just going to ask some frequency questions of how many times these things have happened in the last 10. And again, for simplicity's sake, I am just going to enter 1 for each of these. And then the last question on this page is going to ask, in the last 30 days, did you receive any form of counseling and support from a private or public or self-help group for any of the following? And if you answer yes, it's going to then tell you the options that are available. And again, there's quite a few, so you can scroll down and see, and we'll just pull those couple forward, and then we'll move on to the next page. Education level, again, you're just going to select. Some of these are very similar to the substance use domain, although some of the lists might be a little bit different. We'll say none here. Months that you're employed, days of work, I'll just say 6 days. In the last 30 days, and jobs lost to gambling. And then here on the financial, you'll now see a new column that shows up here with refuse.no. That you'll see that happens on a couple of these screens. They were telling us there's a rainbow outside somewhere, so I can move my cam out the window so you could see it, but not sure where it is, but they're saying there's one out there. So again, you're just going to answer the question, current gross taxable individual monthly income. So we'll just put a number in here. As you hit tab, you'll see that it will gray out. So in this case, if they didn't want to report their total household income, you can choose refused. Again, same thing here. They can choose refuse. I don't want to answer that question. It's too personal. They maybe don't want to talk about their credit card debt or their total debt. And that may change as you build a relationship with them. But you know, they might be willing to say, yeah, I need to make $1,500 a month to do that. And I don't really want to tell you how much I'm in debt because of my gambling because I don't trust you yet. And maybe they don't want to answer that. But again, some may answer this information for you. An important question here: during the last 6 months, has a family or a friend helped you financially so you could pay bills and expenses? And you just select the appropriate response there. And then it's asking you, in the last 30 days, you know, have any of these types of things happening? And I'm just going to tab through these and put yes. Where these become important questions and having the response is we also track this as part of the 30-day follow-up. And we'll see that here in a second after we get through the admission. Times arrested in the last 12 months, again, and we'll say it was a gambling related. We'll say I haven't been incarcerated. Health coverage, primary source of payment, you know, where do you expect this to happen? And this is, I guess, maybe to step aside and spend a little bit of time on this, is that if they have insurance or they have Medicaid and you have eligible providers, staff at your agencies that you can bill third party, then that is what you'll be putting down as your primary payment source. If they don't have Medicaid or they don't have third party, then it'll be the state unit reimbursement that we talked about earlier. And in this case, we'll just say he's got Blue Cross Blue Shield, and we're going to say yes, it does cover. Then this intention to change. Again, this question does not exist on the substance use disorder side, but this is basically a stages of change question. So it basically takes you through pre-contemplative to maintenance, and you just select the response that works where they're at. And we'll just say, my wife's making me come, and I really have no intention of changing. So based on this assessment, is the client being recommended for treatment? So this is sort of that ASAM-based recommendation that you have on the substance use disorder side. Here's where it exists on the problem gambling domain. And so basically you're going to say, yes, you're recommending them the treatment. And then the question is, the results of the assessment have been explained to the client, and the client agrees to treatment. And so if they're agreeing to enter treatment, then you're going to click yes. If they click no, you will see that this last question does not open up. But if they say yes, then there is another question that needs to be asked, and it's to objectively evaluate the state's gambling treatment services. We would like our evaluator at the University of Northern Iowa to be able to contact you. Is it okay to give them your contact information so they can ask you for your confidential feedback approximately 6 months after you leave treatment? And if they agree to, then you'll put yes here. And it's very important that we try to get, for those patients that are at the placement screening, if they're going to be coming in for treatment, we really would like them to be participating. There's also a $30 gift card that they get for participating in that interview process, but they do have the ability to decline. So at this point, we have finished the placement screening. And oh, we found the bug. So we're going to go into that placement screening. It says current gross taxable individual monthly income cannot be greater than the household income. And I think it was because I put refused, and that shouldn't have done that. But we'll go, I guess I could have just hit 5 here, because we put refused there. So let's go back and we'll leave that blank, which will open up here, and we'll just put 2,000 here. So I'm going to make a note of that bug because that should not be doing that. So hold on a second. All right. Thank you for that. Okay, we're going to click finish. We should be good now. So at this point, we want to make sure that we've got an encounter listed. We should be okay on the program that we have. We can use that pre-admission since placement screening is a pre-admission activity. We'll go ahead and click add encounter. This time, again, we'll put individual note. Here now placement screening has shown up because that is now available, and we should now actually see the outpatient services. Now here is, and again, a differentiation on reporting data directly to the central data repository for the substance use disorder side. Within the gambling domain, you actually will be able to designate the actual service that you're going to be reimbursed. So if it's an outpatient initial assessment, it's done by a certified licensed staff. That is here, and if it is done by an independently licensed staff, then you get a higher reimbursement rate, so you can actually select that. And in this case, I am not independently licensed, so we'll select that. Again, we'll put the start date in, which I think we chose 12/7 for these. And in this case, you'll see the duration is blank because we do not need to use duration or put a duration in for the assessment because it's based on 1 unit and 1 unit only for reimbursement. And in this case, we're also going to say Blue Cross Blue Shield, and we are going to put self-pay as the other service. And my headset's beeping at me, so I am going to need to switch off to my other not as good way of talking to you, so just give me a second. But we have that encounter in, and our next step will be to put the admission in, so give me a second here as I change methods of talking to you. All right, I'm just going to do a check here. Can anyone let me know that they're hearing me okay?
So she has the content on all of the information that Kevin sent us. And we're waiting for
Perfect.
her approval.
So let's see, Deb was asking another question here. Just to clarify, if a patient has insurance but it does not pay for gambling treatment, we can bill them through the grant. Also, if a third client has third-party insurance but does not want to use their insurance, we can bill through the grant. Both good questions. So answer to the first question is yes. If the patient has insurance but it does not pay for gambling treatment, then you would bill the state. If the client has third-party insurance but does not want to use their insurance, can we bill them through the grant? I will have to get back to you on that one. I'm not sure what the historical context has been on that one. So, well, and I'll have that in my chat. So, but I'm going to make a note here, Deb, that I get an answer for you on that one.
Hey, Eric, this is Allison.
Yep. Hey, Allison.
Hey, there is a lot. I'm calling in on the phone now, and there is a lot of background noise, like somebody's in the office working or something, but we can hear it all.
Yeah. All right. Let me do a change here real quick. Yeah, it's when I'm on this, it isn't nice as the headset. So hold on a second. Let me make a change here. How is that better?
Yes, that's much better. Thank you.
Yep. No, thank you for letting me know. It was coming off my webcam instead of my headphones, so that was why you were getting all the extra background noise. So thank you for alerting me to that. Okay, so I will get an answer for Deb's question. And that's, again, as you've put questions in the chat, we'll create a FAQ document from this that we'll post along with the agenda so that we've got answers to those questions. So moving on, we have entered recap. So we've entered the early intervention service. We've entered the placement screening. So now we need to enter the admission, which again, we'll just click on admission on the left-hand side. And we're going to get this error message that says the admission is not allowed as no DSM screener has been completed. There's some good English for you. So how do you do that? So you are going to come back to screening and click on screening, and then you're going to see this DSM indicator show up, and also the DGSPS. And I'm just going to show you the DGSPS because this is something that actually could have been used as part of early intervention. That you could actually sit down and do this as part of the early intervention, and you know, so I can go in and say, hey, we talked to this person on the first one. We talked to him on the phone, and we actually went through and did the DGSPS. And if you're familiar with SBIRT, the Screening for Brief Intervention, Referral, and Treatment, that is what this is based upon. And it's just simply 10 questions. The first question is the initial screening question. For the purpose of these questions, gambling means buying lottery tickets, gambling at a casino, playing cards, or for dice or for money, betting on sports games, playing slot machines, video poker, or other video gaming, gambling on the net, betting on horses or dogs, playing bingo or Keno. And then simply asking them, during the past 12 months, how many times have you done these things? How many times have you gambled? And if they respond 5 or more, it will then open up the rest of the questions. And some of you may ask, what does that mean? Why did we select 5 or more? And that's been based out of studies that have been done in conjunction with Illinois and also with Lori Rugel. And for those of you who's Lori Rugel, she's one of the more well-known gambling experts problem gambling experts within the country. And we actually worked with her in the development of this tool. And that was the cutoff that they've used. Very similar to asking questions about your binge drinking. What's the difference between binge drinking and not binge drinking? And so we've set some guidelines. And for whatever reason, research-wise, 5 times in the past year seems to be that cutoff of helping determine whether or not we should talk more about what's going on with their gambling. So in this case, the first 3 questions are the BBGS, the Brief Biosocial Gambling Screening question. And you're basically just asking them those questions and getting a response to each of those. And as you go through each of the questions, you're just putting a response. And when you get to the final one and hit tab, or hit save, I think it is, it will actually
give you what needs to happen next. And so in this case, it's a score of 5 or more that they're asking at least a brief intervention be done. And then you'll see also down here at the bottom, it gives you sort of the history of where this came from. But that's available to be used. It's not required to use. You may find that helpful when you're screening substance use disorder clients for gambling. I know many of our programs historically, when we came out with the DGSPS, have found this tool very helpful in identifying those patients that are involved in substance use disorder treatment that may also have received benefit from problem gambling services as well. So I'm going to go ahead and just finish that. It only can be put into once. When you get done, you'll see that it'll actually show up as part of your as a sorted gambling screen here on the activity list. So I'm going to go back to screening. We need to put that DSM indicator in, and this is required. That needs to be put in prior to any admission being done, so we know the screening happened on that. And again, you're just asking the DSM. These are actually the DSM-4 questions. Some of you will notice that question number 8 here is not in the DSM-5. That is something we've not updated in here. And again, you're just going to go through and answer the questions. And if you ask the past 30 days, then it also responds the past 12 months. If you click no, then you need to ask them about in the past year. So in this case, I'm just going to answer all of these yes. And then click finish. And then you'll see that the DSM indicator admission now has been completed. And at this point, you will now be able to enter the admission, and it will pull everything forward from the placement screening. And I'm just going to put the date. Let's say that I came in on the 10th to be admitted, and you'll see it'll adjust the wait time back to what was the date of first contact, which was on 12/1. And then as you scroll through this, everything else, if nothing has changed, then there is no need to update any of the information in here. But you can scroll through, work with the client, talk with the client, and as information needs to be updated. And you'll see the intention to change is here. And now maybe in 2 days, I'm deciding that I'm have a change of heart on what I want to do. So at this point, you'll click finish, and the admission is then completed. And you'll see down here at the bottom that the gambler admission has now been completed. At this point, then, the program enrollment probably needs to be adjusted because you've admitted them. So we'll come in here to the pre-admission one. We'll go ahead and close this on 12/7. Oops. And we'll say that they were transferred. Click finish. And then we'll add the enrollment for outpatient. And we'll start this on 12/10, which is the date of the admission. Then we'll come over to the notes and then add the new encounter note for that admission appointment. So again, we'll put the individual note, encounter type will now be admission. Now you'll see a whole bunch of additional services that are available. So we're just saying, say we did an individual counseling. This was on the 10th. Duration, we'll say it was 60 minutes. And again, you know, don't enter 65 or 75. You know, if you met for them for 65 minutes, then you're going to enter 60. Sessions, again, is always going to be 1 in this situation. We know that Blue Cross Blue Shield is paying, so self-pay will go here. If you would find out down the road that Blue Cross Blue Shield didn't get paid or didn't pay you, then you could change it to state reimbursement. And that can be done retroactively, and that'll all get out in the wash as far as how we'll be instructing you to submit claims. I'm not going to put any notes in here. We'll just say that we're done. And so we'll continue. You know, if I wanted to say, hey, we're going to have this person have a medical evaluation done, so we're going to put a vigil note, admission. We had them see our doctor, so we'll put the medical evaluation in there. We'll put the start date. We'll say they did that on 12/11. And again, this is just going to be by the session. There's no minutes that go with this one. Again, the state's paying for this and self-pay for the sliding fee. Finish. Let's see. Let's go ahead and see what's another one. Oh, and he needs help with transportation, so let's go ahead and put an individual note in for that. So we're going to give him a bus pass. So we'll put transportation in there. It's for 12. Let's say this is 12/14. That they came in for that. 12/14. And again, you'll put the dollar value just as units. Duration can be blank. And again, state reimbursement. And in this case, there would be no charge for the additional since there's no copay tied to that. And I think 25 is too big a number for a month. I think 20 is the right number. And I think it'll let me, just for purposes of showing you an IOP session. So you'll see IPN, outpatient partial hospitalization, will be available. And you could actually bill it under any of this. So if it's important for you to be able to track that who's an IOP and who's not, there's not necessarily the need to be able to tag that, but that's really your preference internally. But you will see the glitch that we'll run into here. We'll say if you move this person to IOP, we'll say it's happened started on 12/24. What we'll run into is we want to put 1 day, and day is not showing up. So for right now, you'll have to default that to 1 minute. And then the session should also be 1. Hopefully we'll get that fixed before January 1, but we may not. And again, this then would be self-pay would be and then finish. Now, one of the other things that you can also do, and I don't know that I have the ability to do this because I don't think I gave myself. Yeah, so, if we're saying, hey, okay, that didn't really happen, then you can actually come in. If you've given yourself the ability to delete, you can go in and delete those services. The other thing, and again, for programs that have used the VMS, this release to billing, do not worry about that. So the only thing you can, that after January 1, we'll not be using that functionality. So we've gone through putting early intervention crisis in, we've put a placement screening, we've put an admission in, we showed you the DGSPS, we showed you how to put the screening tool in that you have to put in prior to admission. So let's see, we've got another question in that came in from Colleen. Do we complete the admit on the same day of the evaluation or from when they return to services? That's a great question, Colleen. That's really your internal process. If your process is that you admit them on the same day of the placement screening, then you would do both on the same day and you would have to have an encounter for both those services. So in some cases, we'll pay you for the evaluation, and then if you spend 30 minutes orienting them to admission services, then you would put an encounter in specifically for that service. So can a patient be in IOP gambling but meet the number of hour services per week for IOP with a combination of gambling and substance use services? We do get several patients who are dually enrolled. Beth, so yeah, that's a great question. So if you are serving them at an IOP level of care, then that is how you would bill them in gambling and in substance use disorder. You just can't bill both for the same piece. Or you can't bill both sides of the contract for the same service.
Hey, Eric, this is Allison again.
Yeah, Allison.
Is there any talks of actually updating the DSM in iSmart to actually make it DSM-5?
Not currently, because we're looking at a whole transition to doing things differently down the road. So at this point, we're not investing any more dollars into iSmart for those types of enhancements because it's actually fairly expensive.
Okay, thanks.
Yep. Any other questions before I show you the 30-day follow-up? So Vicki Lewis was asking that we will have dually enrolled clients. Yes, it's potential that you could serve a patient both on the substance use disorder side and on the gambling side. So for the substance use disorder patients, you'll be reporting their information to the central data repository. For the gambling specific patient billing and services, you'll be reporting those in iSmart. Any other questions before I move on? You guys are asking great questions. All right, so the next thing that's a little different that you don't experience on the substance use disorder side is the 30-day follow-up. And this is something that you will complete within day 30 and 45 after admission. And so technically, I'm a little early to complete this in here because it's only 26 days after the placement screening, and even less than that admission, but we'll just pretend, I can't put a future date in here, so we'll just pretend we're at that 30-day just to walk you through what needs to be done. So you'll bring it up and you'll just click the next arrow, and it's very simple fields you'll see over here on the left. Very streamlined basis versus what we've had previously. So again, it's going to basically asking when's the last day that you gambled. Okay, I've not gambled since I've come back in the last 30 days. Okay, maybe I've gambled 2 days since I'm looking at the last 30. And again, where did that potentially happen? And then, what was the kind of wagering that you did? And again, you would just fill in, trying to hit my down arrow rather than tab. And then I'm just going to put 0 on the rest of these. Rest of 0. Click the next arrow. And now it's the behavioral question. So it's basically saying in the last 30 days, how many times have I done this? And just for the sake of ease, I'm just going to put 1 in each of these. And then I'll say, yes, I went to an Alcoholics Anonymous meeting. And then how many days have you missed of work? We'll say 0 in the last 30. And then these last financial questions, has any of this happened? I'm just going to put no on all of these. We'll just put a refuse there since it came up that way. And then you're going to reassess their stage of change. And that's simply what gets done. And the beauty of the follow-up, and we will, and this is a good point, because historically we've allowed this to be done by phone as a telehealth service, but telehealth services now are limited only to the initial assessment and not to individual or group. So this will be something that'll need to be done in person, because we want you to get paid for it. I guess you could do it by phone and there wouldn't be a way to bill for it, but we want to make sure that we get billed. So my intention, hopefully you'll set up something within your system to, your own tracking system, or that report that I showed you in SSRS that'll actually show you when these people, when these patients have their 30-day follow-up that is due. This data has been incredibly helpful for us and to you and I as far as evaluative. We've really been focusing very hard over the last 2 years in getting these completed, and we're now up to 65–70% of these getting completed, and it's really amazing to see the impact that providers are having in working with their patients even in the first 30 days. And it's good to be able to give that feedback to you, the great work that your staff are doing and the work that the patients are doing on top of that. So we're just going to fast forward. We're going to say I'm done. We need to put a discharge in. You click on discharge and saying, hey, they're still enrolled in their program, so you need to make sure that there is a closure on that. And so we'll just say we're going to close them out today. And we're going to say they completed treatment. And click to finish. One of the other things that we've been focusing on as well is the discharge reason. And I only bring this up is that we really have no guidance from the department as far as how do you determine is it completed or successfully completed or partially completed. So really we want to really focus on, you know, what's the work that's been done. I mean, historically what we've seen, and some of you who've the previously funded providers that are on the call know that I've talked ad nauseum about this of, you know, we've had situations where we've had a client given the discharge reason his client left and they've been in services for 3 years because they just didn't show up for their last appointment. And so they left. And if I choose client left, I don't have to fill out as much data. So I get that. But the reality is, give them credit for the work done, give yourself credit for the work done. What we found out is, as we've looked at the data through the Iowa Gambling Treatment Outcomes Report, which we didn't even talk anything about, that's sort of the OMS side of the problem gambling, is that we have found that those individuals, even though they have been given a client left and may have been in 12 or more services, they have done just as well. And so we've really started to look at how many sessions and how is that determining when they do that follow-up. Is there a correlation between number of sessions and how well they're doing post-treatment rather than looking specifically at that discharge reason? All right, so as part of the discharge process, we asked the screening the DSM questions again. And again, this would be then an update for the questions that were asked at admission on the admission screen. And so here's that reason for discharge. We're going to say they completed treatment, and we're going to say none of this has happened in the past 30 days. And again, well, I really wanted to not have to answer that last column, but we'll just say I've done really well. My counselor's just been really great. It's helped me tremendously. And so we'll just, you know, some of these were yes on the previous one, and it does not pull forward. So you would have to ask them specifically about, okay, tell me about that in the past year. And then click finish. And then what that's going to do is automatically open the discharge for you. And again, you'll just update the information. And the difference here between the admission or substance use disorder gambling in iSmart and problem gambling is that for substance use disorders, it pulls everything forward from the admission and then you update it. Here, you're doing everything from scratch again. So I'm not going to do my best job of remembering what we put in on my original questions. And I'm just going to put NA at this point because I'm not doing, oops. I went too fast. Let's say I've gambled since the 30th. I think that was the date we were putting in there. And so in this case, if I put 0, it should gray. So I haven't gambled in the last 30 days. That is one advantage. It will gray everything out for you. And we'll move on. And then here, I'm just going to say last 30 days, I haven't had any of this going on. And I'll say, yep. I will just say, I'm going to meeting. Then here's a question, was a concerned person also involved in treatment? So you'll just say, yep, my wife came in. That was really helpful. Then again, you're just picking the responses here based on where they're at discharge. None on that one. So months employed since admission, in this case, it's been 1. I haven't lost that job. And then, you know, my income went up this month. Yeah, I'm going to say I did. No, so, you know, just put some numbers in here. I'm going to say this is all going to be those. I'm going to say I haven't been missed. I think I probably put one on this unless that'll give me an error or not. We'll find out. And then you'll get to the stages of change, the intent recommendations, and then, you know, I reduced or quit my problem and I've been able to maintain. So, and then this client is discharged. You wish to close this case also, and you can say yes. You know, if that was a discharge appointment, obviously you want to put the discharge appointment in. I'm just going to say, hey, we put that in there, and say we're going to go ahead and close that case. And now if we go back and look at the intake, you will see that it's all grayed out and the case has been closed. It looks like saved everything is completed. So I know that was a lot of information to go over in a relatively short period of time. Hopefully it was helpful. We haven't lost too many of you as we've gone through the information here today. So we've got about 5 minutes left. I'm going to go back to my agenda here to see if there was anything else I needed to remember to cover. Oh, get out of the way. There we go. Okay, so I think I have gone through. I was trying to remember what my left field thought was that I was trying to show you and wasn't remembering, but it had something to do with what we had on one of our pages here, but I'm not remembering what it was. So any questions for the good of the cause? Great questions. I am actually going to be out of the on vacation tomorrow and on Monday, so it'll probably be towards the end of next week before I get much of this posted. A question came in from Beth. So are we going to pull the SSR summary report to do the claims billing to grants.gov? So yes, but it will not be the report that's currently in there. So we are in the process of developing those reports. And we're actually creating a detailed report as well that you'll be able to run both for substance use disorders and for gambling. And it'll be in that environment. So going back to, and this will look a little bit funny because SSRS is not set up in train like it is for production. So let me, may not even want to show you this to you, but we'll find out here in a second. Yeah, so I don't have it set up anywhere like we do there. So let me just go ahead and log out, and I'll just log into SSRS real quick. Where is my SSRS icon? There it is. And it's going to open up on this side. Of course. So Beth, as you go into that IGTP reports folder, we will have a report that will be very similar to this IGTP treatment and counter detail that you'll be able to use. Number one, you'll be actually required to report that, submit that detailed report for the date range that you're submitting a claim for. Plus there'll be a summary report that you'll also run that does the roll-up that will tell you these are the numbers that you put on the Iowa grants claim. I'd show you what I've got so far. I think we showed a little bit on the first IPN call. I guess I can show that to you real quick, just for, let me find my Google Drive here. I got too much stuff on my other desktop to get, so let me go find that for you real quick. IPN. Oops, that's the wrong folder. claim support documentation. So yeah, here we go. So this is what we're in the process of finalizing real quick for those of you who do some of the billing on your end. So we'll have an instructions page that will show you exactly what you need to be doing. And then there'll be tabs down on the bottom for each month. So when we're looking at gambling specific, you will see that there are orange, and orange is the indicator that this will be coming off of a report that we will be generating for you. This hasn't been completely updated because some of these will be blue, but for gambling, many of this, so the care coordination, medical evaluation, medical care, medication, recovery, peer coaching, all of those will be coming out of off the report that we'll be providing for you. The only one that'll be a blend is going to be this early intervention, where there'll be some data on the report, because if you've entered those early intervention services into iSmart, you'll have that, but then you may also have early intervention services that you've not put into iSmart that are not patient-centric, or you didn't, or they weren't willing to give you the identifying information to be able to put them into iSmart, so you'll have that in your own internal tracking, and then you'll add it here. So does that help, Beth?
Yeah, it does.
Yeah. So,
the other question I had, with the timing, the data's due in the 15th, but isn't the claims submission to grants.gov also due the 15th?
yeah, isn't it nice how we did that?
Yeah.
So one of the things that we will explain with this is that we know there are some providers who are going to submit their claim on the 1st of February because they have all their data in. And the report will actually, one of the instructions we will give you, Beth, is that you'll be able to select the date that you're basing your claim off of. So in this, it's going to be the updated or modified date for those encounters. And so if you select, then I'm just going to say you're ready to put your claim in as of February 8th, you're going to run run the report that we're going to tell you. You're going to put January 1 through January 31st, and then you're going to put February 8th as the date that you're running that data. And then that allows us to be able to exactly replicate what you're reporting to us. I don't know if that makes sense to you or not, but that's what we're working on. So in the case that you don't have all your data in and you're choosing you want to put a claim in on the 8th of February and you don't have all your data in, then when you get to submitting your February claim in March, then it'll catch up. Those services that you didn't get in or didn't get billed for in the January timeframe would then get caught up in the next timeframe. Does that help, Beth?
Yeah, so it's looking more at the transaction or entry
Yes,
date rather than data service.
Right, yeah. Our encouragement is you're going to get the data in almost real time, but we know some providers aren't doing that. We expect, we've actually heard from some providers is that they don't know that they can get their claims in by the 15th, and can they have longer? And we're certainly allowing that to happen. I think Kathy made some changes in the language. So I don't want to quote it prospectively, but the intent was by putting it on the 15th is that you want to be paid as soon as possible. And so that's why we made it the 15th.
Okay, thank you.
Yep, you're welcome. So another question from Christy Marie and Nuop. An individual comes in and does not know or have a social security number. Can we create one for them in the system? Yes, and that's in the data entry user guide, shows you the specific instructions. Basically, you're just going to use a counter starting with 001. One of the things, I don't know that I have, is iSmart. I think I closed iSmart off real quick, but let me just show you real quick a trick that you can do. I should be able to just get into live here real quick and go into just the client list here real quick. Except it wants me to get into, I'm just in the production. I'm just going to show you. So one of the things that you can do is like, I'll just see if I've got anyone in here in residential. So you can click on these columns are sortable here. So you can actually click on that social security number and it'll put them in order. And so in this case, if you are just reporting the last 4 digits, you'll be able to track whether you put it in. So you could put it in as the first one is 001, since, or you could say, okay, this one was 2345. But we want to have some internal control over how you're going to assign that. So if you've not ever done it before in iSmart, you could start with 001. Next time that situation comes up, you would do a search and then assign them 002, etc. Does that help? Okay. Any other questions? I know we're about 5 minutes over. Any other questions? Well, thank you so much for being on. Hopefully this was helpful for you. As I said, we will get this posted as a training. I'll do my best to get this out by the end of next week, so that if you've got staff that you want, and well, certainly I know that we didn't have all the agencies on today, but certainly thank you for being on here. Hopefully this was helpful for you. Certainly wish each and every one of you a happy and joyous New Year, and stay safe out there. And hey, when I'm back to work, we'll be in a whole new thing, and we'll be rubbing elbows together. So look forward to it, and please let me know how I can be of assistance. I appreciate looking forward to working with everyone. So thanks everyone. Take care.